Hola, I'm Eliseo Perez Estable, Director of the National Institute of Minority Health and Health Disparities, and I'm sorry that I could not be there in Puerto Rico with you today for your scientific conference of the Clinical and Translational Research Consortium that is going to focus on practice-based research and translational research. I want to first acknowledge and special greetings to Dr. Kenita Thompson, who extended an invitation for me to attend, and we're sending this as a substitute. Dr. Marcia Cruz Correa, whom I met and talked to while I was visiting there in February, Dr. Carlos Luciano Roman, and Dr. Robert Hunter, all of whom are leaders of this important project. I also want to acknowledge the participation of Dr. Charles Irvin, Director of the Vermont Lung Cancer Center at the University of Vermont, as your keynote speaker today. I want to say a few words about translational research and why this is important. It has been a key buzzword at NIH now for the past several years, and we're really referring to research that comes from bench to bedside, and then people said, well, bedside to community, affected population, and actually now even bench to community. So the idea that discoveries that go on in the basic laboratory, in the basic science laboratory, rather than wait years for it to be translated into practical impact on the care of our patients, that be shortened. And similarly, discoveries both from the laboratory and from clinical research that have implications for the population as a whole be shortened, and that time period be shortened. One mechanism to do that is to have scientists talk to each other, work together, and share in their approach and disciplines. And this is exactly what a center like the Translational Research Center in Puerto Rico should do and is doing. Regards to what we are most interested in addressing from the minority health and health disparities perspective is really helping us figure out what factors interact that lead to different outcomes. Sometimes those outcomes are worse for many conditions. The social disadvantage interacting with the physical and cultural environment, the structure, the system, and behavior of individuals all lead to worse, higher rates of disease, higher mortality, worse quality of life, and just overall greater burden of disease. And figuring out the mechanisms that lead to that so that we know where then to intervene. Sometimes we see results in some minority groups, particularly the Latinos in Puerto Rico, that have actually better outcomes for some of the leading causes of death and disability. And rather than say, okay, we don't have a problem, I think knowing and understanding why that is and being able to preserve and even improve on that, I think is an important scientific inquiry that we should pursue. There may be some aspects of genetics that matter here in terms of the mixture of the Latin American population. There's also the factor of resiliency and how immigrants, for example, in the U.S., are able to be resilient in certain situations. And being able to compare immigrants to the U.S., Puerto Ricans who move to the U.S. and live here in the United States to those who stay on the island, I think is an important laboratory for inquiry on these topics, and so I'm very excited about those possibilities. And that engages not just the social determinants that we are very accustomed to emphasizing, but the behavioral issues of individuals, the biological discoveries that have developed over the last 10, 15 years especially, and how those interact with our healthcare system and society in general. So clearly not one thing that one discipline can possibly do. Now, your Clinical and Translational Research Consortium has made a number of important contributions that I want to recognize, and we look forward to seeing more come out. Working with new investigators, junior investigators, to fund pilot projects and look at new areas involving other scientists that have either secured independent funding or get independent funding, in part due to the leverage that they can get from working with your center. And I applaud the research that addresses key areas such as HIV, cardiovascular disease, cancer, neuroscience, and overall biomedical informatics. This really resonates with our priorities to understand the etiology and of the health outcomes that lead to both adverse and beneficial outcomes associated with race, ethnicity, and socioeconomic status. It's two central pillars that we are focused on in interaction of all the factors that I mentioned earlier. So in closing, I want to say that at an MHD, we have undergone a process to develop a vision of what our research areas are. We have arrived, I think, at a reasonable conclusion of what minority health is about, what health disparities is about, and the research in these two overlapping but not fully overlapping areas. How our contribution to inclusion in clinical research is important and a critical factor of the diversity of the biomedical workforce, something which Puerto Rico, I think, is well positioned to contribute to on a global stage. I want to let you know that we are going to emphasize more research in populations and population health. We're going to emphasize research in the clinical setting, in the healthcare setting. And these are going to be reflected in some of our new announcements that are going to be coming out over the next couple of months. One that we already released a press release on is on surgical outcomes in health disparities. We'll have one on social epigenomics, one on immigrant health in a broad way, and one on the care continuum of HIV-infected youth and young adults. We also will continue to have an interest in applications in health services research and the healthcare setting. So thank you for all your contributions to the field, and I hope you have a terrific day today with this program.